I'm Olga Acosta Price. I'm Associate Professor in the Milken Institute School of Public Health in the Department of Prevention and Community Health. I'm also Director of the Center for Health and Healthcare in Schools. My hometown is Ellenville, New York, kind of an hour and a half north of New York City. It wasn't until I started working in public health that I realized and had done a study where we were looking at densities of populations and how you determine whether something's an urban area, a suburban area, a rural area, that I realized that I actually grew up in a rural area. But I have always been a city girl at heart. I'm actually a clinical psychologist by training, so I have a Ph.D. in clinical psychology, but my interest has always been in my training in clinical community psychology. Actually, public health is a very natural fit for me. I love being in public health. As a clinical psychologist, I've really been trained to work with individuals in small groups to, improve their well-being. And public health allows me to really utilize some of those skills, but to think about broad population-based interventions and really think about public mental health and how we support the well-being of, large populations. Prior to coming to GW, I was actually with DC government. I directed a citywide program called the School Mental Health Program, working with a government agency that oversees all of the mental health supports for DC, but in partnership with the DC public schools and the public charter schools. So we were really bringing increasing access to mental health care and prevention in schools through these collaborative partnerships. So what I find really promising about public health is that traditionally public health really has focused on physical health. There really has been a lot more work and a lot more movement in how we integrate mental health and emotional well-being into public health systems. And I think being at GW, we have an incredible opportunity to really be leaders in supporting that movement. Probably the best advice I've gotten, because I give it to students all the time, is do what you love. What a lot of us do, we don't really see as work. It's not, a job. It's really a career. It's a passion. It's got to be something that is not just, you're just not engaged at your head, you're engaged with your heart. What I think makes a truly great public health student is one who is really curious, and that they question and want to understand kind of what's underneath, what's driving the issues. Okay, I think so. The three things that I cannot live without are coffee, my family, and my cell phone, and unfortunately in that order. Coffee I need to just wake up to the possibilities of my day, but my family really is my pride and joy and my love, so I can't live without them. My area of research is school mental health, the bringing together and the integration of behavioral health and education systems. That's my specific area of expertise. I direct a center where our work has broader implications for school health, and we really look at ways to integrate public health, healthcare, and education in ways that we can improve all three of those systems to support kids and families for better health and educational outcomes. One of the biggest problems that we're trying to focus on at the center is how to sustain effective school health programs. There are many very well researched and implemented school health, physical health and emotional well-being and obesity prevention and bullying prevention programs really throughout our schools in the country. But the biggest challenge is that they are often not sustained more than through their pilot implementation. One of the things that we want to do is to really understand the kinds of activities and policies that can be put in place so that good, strong programs are really available to communities long term. If I had to explain to a young child what public health is, I would say it's the things that we do to help keep people happy and healthy and productive. I'm like, what do I say to my kids? I don't even tell them what I do. I'm still trying to tell my parents what I do.